So I would like to welcome everybody to our two-day webinar series, the CED, Digital Health Innovation in the Time of COVID program we put together. Over the next 2 days, we have a number of very distinct speakers that will address various topics in the area of digital health innovation, and specifically under the umbrella of the global pandemic and global crisis we've been through over the past year and a half, and which is still certainly a burden on all of us across the globe as we're still experiencing the effects of the pandemic. I would like to welcome everybody who took time out of their busy day to join today, and certainly my thank you to all the speakers who volunteered their time to present to us today. Next slide, please. My name is Axel Worth. I'm the Chief Security Strategist at MedCrypt, and personally have been involved in the topic of digital health for more than 12 years now. And specifically, my background is in cybersecurity. So I come at the topic maybe with a little bit of different background, hopefully complementary to what most of you bring to the table. Next slide, please. And we have lined up for you today an array of very distinct speakers, recognized experts in the field. We're going to be talking about, and we're going to cover a wide range of topics, very informative topics, everything from the policy perspective over the trend to virtual delivery of healthcare, innovation, and how it relates to entrepreneurship. Then advanced technologies like AI and telehealth, as well as then a specific discussion of COVID-19 and how to actually manage COVID-19 vaccination rollout with digital health tools. Next slide, please. So if we look at our healthcare system today, and it's really not limited to a specific country, I think the challenges I'm listing here apply globally to all health systems around the globe. We all are dealing with an increasingly aging population and an increasingly growing population. So we have more chronic diseases to deal with, and we have rising health costs we need to find ways to manage. We also are challenged with the health challenges through global warming, as most recently demonstrated in the US and Canadian Northwest, where we have already reported dozens of deaths due to the recent heat wave. We're faced with globalization and the impact of globalization on disease, as demonstrated, for example, with COVID over the last year and a half, but also growing societal inequality of health delivery and health quality, and that is between countries, but also within a given country and a given health system. We are all challenged with education and resources, but having enough people to provide medical services, to manage the medical equipment, the devices we're dealing with, while technology is advancing at rapid pace. Health system is digitizing. We have more health data, and at the same time, we have growing cyber threats as the healthcare system, and the growing number of digital systems and data becomes an increasingly attractive target to cyber criminals. So to sum up this slide, yeah, we are faced with a pandemic, but also with challenges of care delivery, with environmental stresses on our health system, with financial burden, socioeconomic challenges, and so forth. So clearly, and please bring up the next slide, clearly the health systems across the globe are challenged to deliver access to care, affordability of care, and quality of care. And digital health is one of the tools that can help us address this problem. We shouldn't confuse, though, the tool with the solution. I think the solution we collectively need to address is much more complex, and involves much more than technology. But technology and the tools technology gives us can help us to reduce cost, improve access, augment the sparse resources we have, decentralize care delivery by, for example, moving care into the patient's home, improve outcomes, and also reduce the impact of local and global health events. Next slide, please. And there are many examples, I think, which support the things I just talked about. And I just picked one here to highlight really the challenges we all are facing in our daily work. And this is a report from the US Health and Human Services Office of the Assistant Secretary for Preparedness and Response, basically a report that deals with the need to protect the nation's physical and psychological health, limit economic losses, and preserve confidence in our ability to deliver care and in our ability to keep our health system functioning through natural disasters, accidents, and other incidents. And what is interesting in this report is that they identified 4 key threat areas, and I would encourage everybody to read the report because it's quite insightful. And there are things in there when I read the report for the first time about a year ago that, I checked off as, yeah, I was expecting that. Things like extreme weather events, natural disasters, pandemics and infectious disease, but also chemical, biological, radiological, and nuclear threats. But also, interesting enough, the list of the top 4 included technology and cyber threats. And I think that is an area where we all are called to action, right? We all, because of our role in health technology, are asked to support, to make sure that the technologies we're implementing are reliable, deliver what they promise to deliver, and most importantly, and that goes back to my background in cybersecurity, are protected from cyber threats, right? I read this morning an article that, for example, the ransomware attack on the healthcare system in Ireland so far has cost the country $600 million, which is, a significant price tag even for an entire nation to cover. So clearly, these are all very important topics we need to address, understand, mitigate, and take on as part of our daily job routine. And with that, I would like to hand off to Dr. Badnjevic for the second part of the introduction. Thank you.